Medicine today faces a host of unique problems that we as a society are still learning to adjust to. In the US, especially, costs have astronomically increased. We face challenges of providing healthcare in an increasingly globalized society. And there's a lot of volatility, especially with the recent election of Trump as president. All of this leads to a cumbersome and ultimately broken medical system characterized by waste, bureaucracy, and general instability. So, policymakers and analysts and doctors have really focused on this idea of limited resources in recent years in order to figure out what can and can't be improved via analytical methods such as linear programming. Past models have focused on physician decision making, efficiency of healthcare providers, and the allocation of resources in developing countries, but there has been very limited research in surgical services and how optimizing surgical services specifically can impact a hospital's overall performance. One doctor thought that this thinking was flawed, and so what he did was apply a linear programming model to a department of surgery with the goal of maximizing overall hospital financial performance and physician returns, since he believed that surgical services and were intertwined to the hospital's many other services. So this is a closer look at the LP model they actually used. These researchers defined the variables as the procedure mix, and examples of different procedure groups, might be a coronary bypass versus a thyroidectomy. And they set the objective to maximize financial performance, subject to constraints on operating room time, recovery room time, ICU bed days, etc., etc. And what they found was actually really interesting. Optimization increased payments to the surgical department by 3.6%, and increased hospital total margins by 16%, which is huge. This paper demonstrated the disproportionately large effect of surgical services on overall financial performance, which can have important future applications regarding decisions about future procedure mixes. Another important thing they did was determine shadow prices. For example, 1 hour of operating room time yielded $380 in additional profit, showing that an improvement in operating room efficiency was likely to be financially beneficial. The data and analysis shown can therefore help an institution to decide on its optimal procedure mix, identify and target areas for improvement in efficiency, and ultimately align quality surgical care with financial performance. But this is all on a micro scale. LP theory can be applied to global macro scale health problems as well. One paper, for example, looked at dynamic modeling programs with regard to the spread of swine flu in 2009. And in an increasingly global society, it's clear that LP theory not only has significant benefits at the local level, but also on a global scale.